Hello everybody and welcome to my second vodcast talking about dealing with cancer during the time of coronavirus. This time I'm going to focus on the chemotherapy sessions I've had, so you get to learn a little bit more about what it's like to go for chemotherapy. Just a bit of background for those that didn't catch the first vodcast. Basically, I found a lump in my breast in December. I was diagnosed with breast cancer in January and I had 2 operations in February, one on the breast, one on the lymph nodes because it had spread there. And I'm now undergoing chemotherapy to make sure it doesn't come back. That's the idea. So I've had 2 chemotherapy sessions so far. The first time my partner was allowed to come with me, which was good because it was the first time, but since then they've changed the rules and basically you're not allowed to have visitors, so I have to go on my own. So that's sort of been the main difference between the 2 sessions, although the first session did involve a long wait. Basically, we go to the hospital by taxi because we've decided going by public transport is not a good idea. So for the first session, my partner and I both went. We were given some gloves by one of the nurses who did my chemo assessment for me, and we've ordered some more. So now we have a stack of gloves and we have a few masks that we were able to get, but we've got some more coming. So some more reusable ones that will last longer coming. We've got the disposable ones at the moment. So basically we ordered a taxi, we put on the gloves and the mask, we got in the back of the taxi and it took us to the hospital. So once we arrived at the hospital, we had to queue to get in, standing 2 meters apart of course, and basically when you get to the door they make you sanitize your hands first, take the gloves off, sanitize the hands, and then they ask you a load of questions to make sure you don't have any symptoms of coronavirus. Once they're satisfied that you don't, they give you a piece of paper that you need to hold on to show to the various departments in the hospital so you get allowed in. So we took that with us to the chemo ward, which is up on the 7th floor. There was a team outside the ward and they basically asked to see the piece of paper, asked us a couple of more questions and took our temperature to make sure we didn't have a high temperature. We were then allowed into the chemo ward. So not long after arriving, I was called through for a blood test because they wanted to double check some of the numbers on my from my liver from a previous blood test. They're fairly satisfied that it's fine, it's nothing to worry about, and it's probably partly due at least to some other medication I'm taking. So unfortunately, we knew that it was going to be at least a 2-hour wait for the results of the blood test to come back. So we were set for a very long wait that day. So after 2 hours, we kind of wanted to see if they'd done the test and had come back, and unfortunately we couldn't really get hold of anyone outside of the chemo ward to find out what was going on. We asked a few times, but obviously we understand that everyone's very busy with the coronavirus. This was sort of 6 weeks ago, so it was a bit earlier in the process, so I think they were still kind of sorting things out. The situation was changing, not only daily but hourly in some cases. But obviously it's quite frustrating when it's your first chemo session, so I was getting a bit anxious because I was hoping they weren't going to send me home, and I just wanted, just was keen to get on with it for it to go ahead. So eventually it was, about 5 hours later, I actually got to speak to the consultant who'd finally had the chance to look at the blood test results. She'd been in meetings due to coronavirus and how the hospital was organising things and hadn't been able to get to them before. So as I said, it's frustrating, but I do understand the difficult situation they're in at the moment. So she was sort of fine. She had to adjust one of the chemo drugs a bit, but she said it's fine and go ahead. So about an hour later, so we ended up waiting about 6 hours, we got called through to the ward. So I sat on the sort of hospital bed for the chemo, which is it's somewhere between a chair and a hospital bed really, but it reclines, so it's nice, and you've got the table. And my partner sat on the chair next to me. So the first thing they do is put the cannula in your hand. Once they've done that, and my veins are a bit badly behaved, so that took a little while to find a vein, but I'm used to that by now. First thing they do is they put through some little bit of saline to make sure it's working, and then they put in the steroids and the anti-nausea drugs, which they give you before you start the chemo. So that takes about half an hour, 40 minutes on a drip coming through. After that, they put in the first of the 2 chemo drugs, which is the ones I'm taking is colloquially known as the Red Devil, the first one. They did say that without having the cull cap, this was kind of 100% hair loss guaranteed, and that is, I was later told, due to this drug known as the Red Devil. This comes in a big syringe, and the nurse actually sits there and flushes it through. So there's 2 of those. They take 15 to 20 minutes each, and the nurse sits there and pushes it through for the 15 or 20 minutes. Then after that, the second drug comes through, which is half an hour on a drip. So that sits. You put that in the drip. That you just sit back, and they wander around and the ward and get on with things, and you just sit there and wait for that one to go through. Then when that's finished, it's sort of 30-40 minutes. It seemed to take a little bit longer the first time, but anyway. When that's through, they let you take it out and you can go home. So gloves back on, mask back on, back into the taxi, back home. So obviously the first time it was quite frustrating with the 6-hour wait, but we did have, there's a very nice woman who gave, initially just me some food because it was patients only, but she took pity on Julian, my partner, because it had been such a long wait, and later gave him some of the food as well, so that was good, at least he had some lunch. Obviously I was disappointed to hear that after that he wasn't going to be able to come with me and I had to go on my own, but fortunately the second session was a lot quicker. I was only waiting about 15 minutes to be called through, so I was in and out in 2.5 hours, which was brilliant. I was really happy about that. The next one, unfortunately, they've got to look at my mouth because I've been having a bit of a toothache, so hopefully, that won't take long. I won't be waiting too long for the doctor, and hopefully next time will be quick as well. So anyway, I just wanted to give a little bit more insight to what goes on with the chemotherapy and some of the measures they're taking at the hospital that sort of makes a difference dealing with it at this unique time.